All right. Thank you, everyone, for attending this webinar on selling veterans with retiree benefits. Just so you know, if you ever attended one of these webinars before, there is a chat box, I believe, on your top right screen. If you have questions, please put them in there. I will address them at the end of the webinar. There's a lot of material to get through today, and it might be answered later in the presentation. All right, so my name is Kate Therrien. I'm the sales manager of the South region here at Knight, Schlosson Fleming, and today we're going to be going over selling veterans with retiree benefits. So I myself am not a vet. However, most of my family is actually retired military, so I hold this topic in high importance, and I've actually firsthand seen agents who have messed up this process by not checking the facts or the benefits. There's a lot of confusion about how to handle this demographic. There are currently 2.1 million retirees in the U.S., and that's according to the VA. So this market does have opportunity, but more importantly, as an agent, you will run into military retirees in your career, so it's important just to understand their Medicare benefits so you don't lose out on sales. Okay, so today I let you know a little bit. We are going through a lot of information. United Healthcare actually has a presentation very similar to this about retiree benefits and how you can use United Healthcare's products to fill in the gaps. But that presentation is about 2 hours long, and it's always given live. So we wanted to give an opportunity to our agents to get a little inside look at the veterans and how to sell veteran retirees. So just so you know, there's a lot of other resources out there, and I would be happy to give anyone who's interested those links and appropriate webinar registration times. Now, the first thing to do is identify the type of veteran or retiree. And then we're going to go into why a veteran would even venture outside of the VA. Things like the priority groups, provider restrictions, coverage gaps, even copays. So we're going to go into that in detail. Then there's also options available. For instance, there's going to be Medicare Supplement, Medicare Advantage without the PDP, and Medicare Advantage with the PDP in place. So we're going to go over solutions. That's basically what that's going to be. And then common frustrations that come out of it. Billing problems that a vet could have, and then coverage concerns and how to answer them. I'm also going to let you know a few questions that you can ask to get to the actual information you need to help these veterans. And then I'm going to answer your questions. So as you can see, we've got a lot of ground to cover. So first stop, retiree types. The first order of importance is the definition of a military retiree. All military retirees are veterans, but not all veterans are military retirees. What makes a military veteran is someone who has served in the armed forces and was discharged or released from service after their term. As long as the condition is not dishonorable, they may qualify for VA benefits. So that would describe a military veteran. Though current and former members of the Reserve or National Guard who were called to active duty by a federal order and completed a full period for which they were called to active duty may also be eligible for VA benefits, but those that are in the reserves or the National Guard with active duty for training purposes only do not meet the basic eligibility requirement. So keep that in mind. There's always loopholes. Check the statutes and always direct people with questions to the VA. They really should call their VA office for more than one reason, and we'll get into that. Now, a military retiree is actually a former member of the Uniformed Services who is entitled to VA benefits under statute of law. So that's actually decided by Congress, but a few of the current qualifications are 20 or more years of service, a permanent retirement based on a disability from combat. Also, only retirees are eligible for TRICARE for life. So when you hear TRICARE for life, that signifies in your mind that they are a military retiree. But there are plan options available there. Okay. So one of the big things with active duty and retired service members is DEERS. If the only thing you retain from this slide is that DEERS exists, then I'm happy. The definition is that it's an internal record database used for benefits. The biggest thing is to make sure it is updated and correct. When you're talking to a military retiree, just mention this. It will give you some credibility. The fact that you even know the term is going to give you some authority on this topic. The information needs to be kept up to date, or when plans go to coordinate benefits, they will run into issues in administering the benefits. That will cause billing issues. It's the first place things can go wrong. Now, just because you're a retiree does not mean you're actually enrolled for VA benefits. You have to enroll in the VA healthcare system to maintain access to certain VA health benefits. Your eligibility is determined by internal measures and requirements. So, as an agent, and someone says, oh, I'm a military retiree, or I'm a vet, that is fantastic. But you should probably be asking a few more questions of these people. Ask, hey, when's the last time you updated your DEERS information? Or have you registered at the VA healthcare system? When's the last time you went to the VA facility? If they haven't done those things, they most likely don't have access to any of the VA benefits. That's a big red flag for you to pay attention to. So what happens, though, once your application for the VA healthcare system is started, you're assigned an enrollment priority group. Certain veterans may be eligible for more than one priority group, and in that case, the VA will always place you in the highest priority group that you're eligible. We're going to get into more details about what a priority group is in a few moments. So, under the VA health benefit package, the same services are generally available to all veterans. So once you're enrolled, you receive a personalized Veterans Handbook, which will detail the VA health benefits that you're entitled to, with information concerning access to VA health care, like where is your facility. When speaking to a vet, be sure to pull this handbook out. Make sure you get that handbook or policy to the table so they can see the benefits that they have and the benefits that you can offer them. This is where you're going to see the co-pays and things that they might not be aware of with their benefits and gaps in the benefits. They're not always all-inclusive. Now we've gone over what a veteran is versus a military retiree, and then who actually has TRICARE for life. Those are only the military retirees. Everybody else just has access to the VA through their veterans benefits. So those are two big distinctions here. Now, why would someone in either of those groups look outside of the VA? Simply put, they might have a formulary restriction, disease management issues like diabetes, or difficulty getting access to care due to distance or wait times. And as always, there's a need for extra benefits like hearing, dental, vision, even rides to the doctor. We'll get into some detail with a few of these reasons today, but the main thing I want you to get from this section is that it's important to ask questions about these items. Ask if they've even enrolled for VA care. If they haven't, they might not be able to get into the facility if something immediate happens. There might even be wait times before the vet can receive care. It takes time to process the application and get their priority rankings. So you need to also ask if they know their priority group. If their number is high, do they know about the copays that are going to exist, or means testing? And again, the wait times that could be in place for treatment if you have a priority rating of 8. And then ask what they would do if Congress changed funding. What if benefits are reduced? There's always ambiguity when a new president takes over. What happens if funding decreases? A lot of vets don't know. You're there to educate them and give them a backup plan. Everyone needs a backup plan. So, first question I'm sure everyone's thinking is, what is a VA priority group? Well, the VA assigns priority groups or importance rankings in order to balance demand versus resources. The number of veterans who can be enrolled in the health care program is actually determined by the amount of money Congress gives the VA each year. As we know, funds are limited, so the VA sets up priority groups to make sure that certain groups of veterans are able to be enrolled or seen before others. The lower your group number, the higher your priority. That means higher numbers have full copays and longer wait times, like I mentioned. They're lower priority. Another point of consideration is there's no guarantee that in subsequent years of Congress that they'll appropriate sufficient funds for VA to provide care for all of the priority groups. So what could happen is that if you're in a lower priority group, like 6 through 8, you could potentially have no health care coverage if they don't receive enough funding. So what qualifies someone for a priority group? I'm going to give you a couple examples. There's a lot of details. If you go to the VA website or actually tricare.mil, you can get a lot of details there as well. And then there's the va.gov. But priority group 1 is for veterans with the VA-rated service connected to disabilities of 50% or more debilitating. Veterans determined by the VA to be unemployable due to service-connected conditions are in priority group 1. These are people that have the highest priority and are seen first. Now, priority group 8. These are veterans where their gross household income is above the VA and the geographically adjusted income level. It limits for their resident location, and these people agree to pay copays. So Group 8 are people who are most likely not disabled due to service, and they have higher income. So as a result, they have co-pays, longer wait times, things like that. So how that's determined is actually through means testing. Some people might not have gone through means testing yet. What that is basically they do a background check and see how many assets you have. If you have a lot of assets, you're going to have to pay more. Most systems are set up like that, but in the VA, not only if you have a lot of assets are you going to be paying more, but you're less critical. So there's going to be a longer wait time for care. Now, that's priority groups. If you have more questions, please go to the va.gov. They have everything listed in detail, including how to go through the enrollment and when these priority group ratings are issued. But any vet, just so you know, is going to know their priority group number. It's just something that is ingrained. Now, provider restrictions. The VA only provides benefits when a vet or retiree goes to the VA facility and sees a VA doctor and gets their VA prescriptions filled at a VA pharmacy. They can't go anywhere else. So, simply put, to access VA benefits, you have to visit a VA facility. No ifs, ands, or buts. In most cases, they're located on military bases. So there are a few restrictions, but if you do live too far from a base, there are allowances and cards you can get to get access elsewhere, or if the wait times are going to be over 30 days for a procedure you need, you can get a temporary pass to go somewhere else where the VA will act as if it's a VA facility and payments. Again, we'll go into a little more detail about that later, but all of those details are on va.gov. So the next topic, creditable coverage. The VA is creditable coverage for Part D. However, the VA health care is not considered a health insurance plan. This means it's not creditable coverage for Part B. So, if you decide that the TRICARE drug coverage meets your needs, you can choose not to join a Medicare drug plan, and you can save the monthly Medicare Part D premium costs. You can keep your current coverage, and it's almost always going to be to your advantage to keep your coverage without making any changes for the Part D. An exception is if you qualify for Medicare's Extra Help or Medicaid. You might benefit from applying for the Extra Help and accompanying MAPD Special Needs Plan if the market offers them. So that's just something for the Part D there with TRICARE. However, not everyone has that. So you're going to definitely want to take a look at what benefits they actually have access to. So back to the PDP. TRICARE prescription drug coverage is considered credible drug coverage, which means it's at least as good as Medicare drug coverage. So if you decide you want to join a Medicare drug plan after you're first eligible, you won't have to pay a late enrollment penalty if you join within 63 days of involuntarily losing your TRICARE coverage. If you don't lose your coverage and you still want to join a Medicare drug plan, you have to wait for a valid enrollment period, and you're going to want to confirm with the VA that you're able to do so. Again, the default answer when vets ask is call the VA, ask your provider, administrator, and they will give you an honest answer. Again, though, you will not have to pay the late enrollment penalty. But in the reverse, if you have TRICARE coverage and you choose to disenroll from your Medicare drug plan, you get a special enrollment period to do so. So if you want to get a separate Part D plan outside of TRICARE, you have to wait until the open enrollment period for that. But if you want to leave a Part D plan in the open market and go back to TRICARE coverage, you have a special enrollment period to do so anytime during the year. But like I said, the best practice is always to contact TRICARE before making any changes to your drug coverage. So lastly, how the plan pays. If you choose to enroll in a Part D, your Medicare drug plan pays first and your TRICARE pays second. If you're in a Medicare Advantage plan, the Medicare plan and TRICARE coordinate the payments. All right, I'm going to repeat that one more time. If you enroll in a Part D plan, your Medicare drug plan pays first and TRICARE pays second. If you are in an MA plan and a TRICARE, they will coordinate payments, which is why you call TRICARE and set up the coordination, and you need to make sure your DEERS is updated. All right. So I did mention copays. We're going to get into some detail about that. Copays are determined by priority level and income threshold, which is that means testing. You can see here the means testing thresholds. The website at the bottom is where all this information came from. It's updated and based on acts of Congress. They can change, and they do. Really, always go to va.gov. However, all this stuff is also updated on military.com. They explain it very easily to vets, and it's constantly updated and monitored by the VA, but it is an external source. It's a .com, so it's not always the right place to go. But copays. That's another reason someone might want to consider an additional plan to the VA benefit. Copays that the veterans retirees may face include outpatient, inpatient, extended care, and medication copays. For instance, a PCP visit for a vet in 2017 is $15, and a specialist is $50. We all know there's plans out there with a 0 PCP and a 0 specialist. So in that case, it would be beneficial to take a look at the MA plans available. Now, you might be responsible as a vet for one or more of the federally mandated copays that the VA is required to charge. Though veterans who are service-connected 10% or greater are not required to pay a copay for inpatient and outpatient medical care, but they still have extended care and medication copays. So what that means is if somebody is disabled from a service-connected injury, maybe they lost a foot or eyesight, they do not have copays for inpatient or outpatient. But if someone was injured maybe in a farming accident or a car accident and lost a foot or was partially blind, they would still have co-pays because it is not service connected. Current rates are always obtained at any VA healthcare facility or their website. Okay. Now, I did mention the Veterans Choice Program. This is where a vet might be able to use a facility other than the VA. There are only 3 reasons you can get this card, and they are temporary. If you were told that your wait for care is over 30 days, you can get this card. If a facility is over 40 miles from your residence, or there's excessive travel burdens, you can get this card. Now, as you can see on this card, at the top right, it says it's a temporary program. It only came to be with the ACA, and it has a time limit. Congress can choose not to extend the program, in which case then it's not available. And these vets who are using this program, because of how far they live from the base, won't have access to care. You can see why that might be a question you want to ask. If they say, oh, yeah, I got a special card, I can see my own doctor here, I don't need to go to the base. Ask them, is that the Veterans Choice Program? Are you aware that's a temporary benefit thanks to the ACA? And if it's not extended, you might lose your local doctors and you're going to have to go to base for care. And then ask them, what would you do then? All right. So we have established who are the veterans and who are the military retirees. And then we've gone over a few things that might cause someone to think twice about only having VA care. So what can they do about it, and what can you do as an agent to sell them? Here's some solutions. Medicare Advantage without a PDP. That works for people with TRICARE for life. They can benefit from having that Medicare Advantage because they're going to have access to more Medicare facilities, a fitness plan, hearing, vision, dental, maybe even overseas travel. When you have a Medicare Advantage plan like this, you can still go to the VA. If you want it as your primary, you go there. VA will then pay those benefits. And then you have your normal copays. Now, if for some reason you can't make it to the VA and you want to go somewhere else, now you have the option. You can go to your local hospital that's in network with your Medicare Advantage plan. And then you have it billed through your Medicare Advantage plan. You can't, when every visit, you choose who is the payee. That's, in short, what happens. So a Medicare eligible can have VA health benefits, TRICARE for life, and a solo Medicare Advantage, or actually a Medicare supplement as well. So you can have 3 different plans in place as a vet. So let's go a little briefly about the Medicare supplement. As we know, it's more expensive, but it's more complete. You have access then to all Medicare facilities. And how it works for billing is the supplement becomes the first payee, and the VA is the second payee in the VA facilities. That's key. Now, overall, how it works for billing is the VA is required to bill private health insurance providers for medical care, supplies, prescriptions, even the treatment of veterans' non-service connected conditions. So that would be the case of a car accident. Because it didn't happen during service, they might not be able to qualify for care unless they had a private plan. They might have gotten billed at a higher rate is what could have happened. So they bill, if you have a plan in place, for the non-service connected conditions. Generally, the VA cannot bill Medicare directly, which is why you have to choose if you're using your Advantage plan or the VA for that Medicare Advantage. But they can bill a Medicare supplemental health insurance company for covered services. Why? It's simple. The VA cannot take any government-funded or sponsored plans. Medicare Advantage, by definition, is government subsidized. Supplements are run by private insurance companies. So how they know all of this is because veterans applying for the VA medical care are actually required to provide information on their health insurance coverage, including coverage provided under other policies and through their spouses. As a result, veterans are not responsible for paying any remaining balance of the VA's insurance claim not paid or covered by their health insurance, and any payment received by the VA may be used to offset dollar for dollar a veteran's VA copay responsibility. That's a little convoluted. So an example, the VA, the PCP copay is $15, as we all know. So you're going in for an annual physical, and there's no copay for that because preventative care if you're going through a Medicare supplement. So what happens is the VA bills the Medicare supplement plan, and the supplement plan pays the VA whatever the Medicare allowed rate is. This cancels out dollar for dollar that $15 copay for the vet, and the VA retains the remainder of the funds. The vet does not get paid out that difference. So you can see how this is beneficial for all parties involved, though something important to remember is having a Medicare supplement will not affect your priority rating or access to care. The billing department likes to see those. As you can see why. They get paid more for service they would normally have to cover themselves, but it does not affect access to care. Now, the big one, Medicare Advantage with a PDP. So when is an MA PDP a good fit for TRICARE for Life members? Well, it's not normally a good fit, but it might be beneficial for a military vet who is not on TRICARE for Life. Because as we remember from that first slide, you can have a military vet who has access to the VA and thinks they're covered through the VA, but they could actually benefit from having an MAPDP. A TRICARE for Life member, it has to be a military retiree. So with all those qualifications, it might rule out more than half of the people you speak with, but that person is probably going to want to look at that supplement or the MA-only plan. Unless a drug the vet is taking is not on the TRICARE formulary, or they don't like the mandated home delivery for common drugs. The VA is going towards that aggressively. Home delivery for drugs is a big push. And then, of course, lastly, when a member is not near a military base to get their prescriptions filled. So you can see how a Medicare Advantage with a PDP might be a good fit if one or three of those conditions apply. Now, you must get prior authorization from TRICARE for Life, and you need to remember it's not the right fit for most TRICARE for Life members. Something as well to make clear when talking about this to vets is that prescriptions from the VA can only be filled at the VA pharmacy, which is on the base. And then in the reverse is also true. Anything prescribed by a PCP or a specialist outside the VA cannot be filled at the VA pharmacy. So, if a person, a vet, who has TRICARE for Life, normally goes to the VA for all of their medical and prescription needs, but they are paying through the nose for a drug, and they're considering leaving and going to the MAPDP, it might be smart. They could possibly save a lot of money. But you need to make sure they understand that they're going to have to go to another doctor to get that prescription sent to another pharmacy to get it filled. The VA doctor cannot write a prescription to be filled at a Walgreens. It has to be filled at the VA. So just cover yourself. Make sure that that is understood. It will prevent future problems. Now, some of the other problems, common frustrations. One of the biggest concerns vets have is that they will no longer have access to the VA care. However, your insurance or lack of insurance does not determine your eligibility for treatment or access to treatment at a VA healthcare facility. Remember, someone can have TRICARE for Life, a Medicare Advantage plan, and the VA. They all work together as long as you follow the proper procedures and call the VA and coordinate benefits. Another major concern is billing problems. When someone has a billing problem, you can almost guarantee they're going to have a rapid disenrollment. Vets who are not used to getting billed by the VA fear getting one in the mail. How you prevent this is by ensuring the PCP knows how to bill for both TRICARE for Life and the MA plan or Medicare supplement. Best practice is providing a reimbursement form. Those can be found on tricare.mil under resources and then claims. It's very easy to find that form, and it's worth taking the time to get it for your client. Now, a common objection. I'm a veteran. I get everything covered at the VA. After going through this presentation, I hope you all know that that's not true. You don't get everything covered. You get a lot covered, don't get me wrong, but it could also go away. So a quick comeback to that is actually asking, well, what's your backup plan? What if you can't go to the VA? What do you do then? Or you could be less direct and say, are you registered in the VA healthcare system? Have you received care at the VA facility yet? If they haven't registered, they actually don't have access to any of the VA benefits. Another thing is, what is your disability rating? And then, do you know what that means? Ask, have you been means tested by the VA? Are you worried you might lose some of the benefits by enrolling in an MA PDP plan? You could also ask, where is the closest facility to you? Or are you sure that your benefits with the VA will remain the same for as long as you will need them? That's a big question. And if all you do is get them thinking and they call the VA benefit coordinator, you've done a good thing, because knowledge about this will inevitably lead them back to you to talk about other options, especially if you have a zero MA plan or maybe even an MAPD plan. All right. So now, does anyone have questions for me? I'm going to go over here. All right. Let's see. It looks like we do have a question. Why would a vet have a late penalty for Part B? Okay. That actually goes back to Creditable Coverage for Part D, but it's not Creditable Coverage for Part B. Veterans commonly forget to enroll in Part B since they believe that they have full coverage through the VA. However, there is actually a possible solution now. If someone is Medicare eligible since 2010, as part of the Affordable Care Act, the ACA, they can actually make an appointment at the Social Security office for a possible waiver of the Part B penalty. Don't call. Make an appointment and see them in person, plead the case. But VA benefits do not count as creditable coverage for Part B. It's only creditable coverage for Part D. Does anyone else have any questions? Oh, of course. The presentation is going to be, it has been recorded and will be on the website in a few days. But you can also call me anytime and we can go over specifics. Like I said, the United Healthcare version of this is 2 hours long. As you can imagine, I didn't do that. So there's a lot more information out there, but it is recorded. Any other questions? All right, well, thank you everyone for your time. I do appreciate spending it with me this afternoon. If you have questions or need any of the resource material again, give me a call at 412-561-7733, extension 137.